with a lot of experience. So maybe Madam RUKIA, you can start by telling us what motivated you to become a community health worker. What are some of the lessons that you've learned during COVID and beyond? And maybe you can speak to what advice would you give health programs that want to improve their community health work. Over to you, Madam RUKIA.
Good morning, everyone. My name is RUKIA. I am a community health promoter from Nairobi, Kenya. I've been a community health promoter since the year 2015 and until today. My work focuses on empowering adolescents, teenage mothers, survivors of sexual and gender-based violence. I provide them with knowledge and link them to organizations with resources to help them make informed decisions about their health. A community health promoter plays a vital role in primary health care, bridging the gap between the health system and the community. We are the first point of contact for many individuals, contributing to disease prevention, health promotions, and global health security. What motivated me is I witnessed the challenges my community was facing in accessing healthcare services, especially vulnerable groups like adolescents, teenage mothers, survivors of sexual and gender-based violence, pregnant women. I also saw lack of awareness in my community that contributed so much on poor health outcomes. I wanted to bridge that gap. And the opportunity to empower others to bring positive change in the community is what inspired me to take that role as a community health promoter. And seeing the impact of my effort, whether it is a teenage mother whom I've walked the journey with, returning back to school and achieving her goals, or a malnourished child who referred to be put in a nutrition program, growing up and recovering through nutrition, knowing that my work has contributed to saving life. My work has also contributed to help someone to make an informed decision. That is enough for me.
Thank you very much, Madam RUKIA. Again, talking about how you are inspired by seeing what your work, the impact of your work, and changing lives, changing families, one person at a time. So that is really commendable. So thank you very much, Madam RUKIA. We will come back to you later for additional questions. And I'm going to ask the audience, please keep your questions. We'll have one round of questions from each panelist, and then we'll take your questions and then do another round. So my next panelist is Dr. Abdelrahman, and I really hope I'm saying your name correctly, from Sustainable Development Organization, SUDRO. And Dr. Abra, perhaps, during the ECHO session, the data session, you talked about the work you're doing with ECHO in Sudan, where we have humanitarian crisis. And so maybe you could speak to what SUDRO is doing to support the community and the community health workers, especially in areas affected by conflict, and also maybe speak to the element of mental health support in such a scenario. Over to you.
Thank you so much. Good afternoon, everyone, and thank you for the opportunity. So this is Dr. Abrar Ali, or Abdurrahim, from Sudan. I'm a community medicine resident and the president of the Sustainable Development Response Organization, Sudan. So before delving into all of these details, allow me to walk you through our journey and how did we found SUDRO on the basis of community-oriented service. So we started at the time of COVID-19. You know how it was overwhelming at that time. And as a group of people or health practitioners who were passionate and interested in community-based interventions.
Before we hand over to the next breakout session. Go ahead.
Community health promoters are indispensable in building resilient health system and achieving global health security, from addressing maternal health to combating pandemics like COVID-19. We are at the forefront of healthcare delivery. However, our work remains undervalued and under-resourced. I hope this summit serves as a catalyst for action, ensuring community health promoters receive the support they need to continue making a difference. Together we can create healthier, more secure communities for all.